Welcome to another edition of Hudson Health. My name is Dr. AJ Akanyili. I'm Chief Medical Officer, Jersey City Medical Center, facility of RWJ Barnabas Health. Today, I would like us to talk about something that's extremely important to this community, and it is mental health. Too often, mental health hides in the shadows. We are overwhelmed with stereotypes about weakness and not getting help, that many people do not get the help they deserve. We're very excited today to have a very special guest with us, a licensed therapist and vice president of our behavioral health services, to discuss all things mental health, self-care, wellness, and the interconnectedness between mental health and your physical health and well-being. I look forward to all these conversations and telling you everything Jersey City Medical Center has to offer for your well-being. Stay tuned. We'll be right back.
No one plans on heart disease, but everyone should have a plan for it. We help patients of all lifestyles and medical histories plan for healthy hearts. We offer convenient screenings without judgment, hundreds of preventive programs, and women's heart specialists. And we're the largest cardiac surgery program in New Jersey. Make plans for a healthy heart with RWJ Barnabas Health. Let's be healthy together.
Newport, the luxury waterfront community on the Hudson River, offers a quality of life you deserve in one of our many high-rise towers. With amenities such as the on-site Newport Path, light rail, Newport Town Square, 3 playgrounds, dog run, upscale restaurants, retail giants like Kohl's, JCPenney, Macy's, and Target. Morton Williams and Acme Supermarket are just outside your front door. A health and fitness center, skating rink, and medical facilities are also on site. Enjoy the New York skyline from our waterfront and various parks. Manhattan is just one pass stop away, or quick ride through the Holland Tunnel. Nursery and private elementary schools all on site. 12-screen movie theater at the Newport Center Mall. Looking to visit? Stay at the Westin or Marriott Hotel. For more information, visit us at newportnj.com. Make lasting memories to cherish forever. It's incredible. It's you, Newport. Live like you want.
Consumer Carpets, 3408 Kennedy Boulevard in the Jersey City Heights, your one-stop store for residential and commercial floor treatments, carpeting, linoleum, tiles, laminates, hardwood floors, area rugs, remnants. All major brands, all in stock. Free estimates, same-day installation. Consumer Carpets, it's savings, selection, installation. Credit cards and debit cards accepted. Financing available. Consumer Carpets, price to fit your budget, installation to fit your schedule. On the net at consumercarpets.com. Consumer Carpets, Jersey City, 201-792-2712.
Welcome back to Hudson Health. My name is Dr. AJ Akanyili. I'm Chief Medical Officer, Jersey City Medical Center, a facility of RWJ Barnabas Health. And today we're going to be talking all things mental health and self-care. Our guest today is Mr. Robert Winston. He is Vice President of Operations at Jersey City Medical Center and Vice President of Behavioral Health in the largest provider of behavioral health services in Hudson County. So what do you think about when you hear self-care? Some people think an exotic vacation, all expenses paid. Some people think of perhaps not having a job and having all 24 hours a day to yourself. But today we want to bring practical approaches to self-care for real people living in a real world that is busy, chaotic, and perhaps people are overwhelmed with multiple responsibilities and families. First thing about self-care is that it is important. Mental health is intertwined with physical health. It is inextricably linked. It's not one or the other. I think we've really done a disservice, and I say this as an emergency physician, when we think that we could thrive and have good health, whether it's a good blood pressure, a good cholesterol, or good sugar levels, all those things we associate with good physical health without being happy and thriving. The good news is that there are resources, especially after COVID. People have struggled. They've struggled with anxiety, with depression, with multiple mental health problems, and there is help. I'm very excited today to talk to Mr. Winston. I really want to pick his brains about what specific practical approaches people can take in their lives. I would also like to talk about the role of therapy, right? Everybody thinks of that proverbial couch, hidden somewhere. But the truth is, even at Jersey City Medical Center, there are multiple ways to access mental health, whether it's by the telephone or by video or in person. For me, I think we need to dispel the misconception that seeking mental health or behavioral health is a sign of weakness. In a community like ours, and for too long, many people have thought that they do not have access, that it is something that is far removed or difficult to get to. So we're going to talk to Mr. Winston about how to get access to the services. What are the behavioral health plans for this community? We're very excited. He's an incredible person to meet, to talk to. He still practices as a therapist, so I know he'll bring a wealth of experience, and I look very forward to this conversation. Please stay tuned.
Comprehensive healthcare is here, here, and here. RWJ Barnabas Health is healing, enhancing, and investing in Hudson County with its 2 newest locations, Hoboken and Exchange Place. Within walking distance or accessible by mass transit, our locations combine convenience with primary and specialty care, including cardiology, women's health, orthopedics, cancer care, and more. Let's be healthy together.
Panna Pinto Properties, Jersey City, shaping the workplace with state-of-the-art office spaces and addresses your company desires. Building residences that define your home environment, adjacent to all modes of transportation with on-site parking available. The right address, the right lease. Call 201-521-9000 or visit online at pannapintodevelopment.com. Panna Pinto Properties, building Jersey City for everyone.
Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, Jersey City. Hudson County's only monument maker, serving all faiths and cemeteries. Design studio and large inventory on site. Cemetery inscriptions and custom orders welcome. Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, just south of Secaucus Road. Craftsmanship that will last for all eternity. Burns Brothers, Jersey City, Albert H. Hopper, North Arlington. Visit us on the net.
Welcome back to Hudson Health. My name is Dr. E.J. Akanyili. I'm Chief Medical Officer at Jersey City Medical Center, a facility of RWJ Barnabas Health. And today I have the unique privilege of talking to Mr. Robert Winston. He's the Vice President of Behavioral Health and Operations at Jersey City Medical Center. Welcome, Robert.
Why, thank you, Dr. Akanyili.
How are you? I'm so excited to have you because this is such an important topic. But first of all, tell the audience a little bit about yourself and your background and how you came into the mental health field in Jersey City.
Sure. Again, thank you. And I agree. This is an incredible topic and one I'm certainly passionate about. So my name is Robert Winston. I am a licensed clinical social worker in New York and New Jersey. I have a master's degree in social work, and I got into this field from a young age, if you will, out of a passion for what it means to take care of oneself, what it means to be healthy, and also a familial trait, as my father is a clinical psychologist as well. So I came to Jersey City Medical Center in 2007. However, I've been practicing in the behavioral health field for now over 25 years. I also have an own private practice where I do psychotherapy on families, couples, and individuals.
So it's interesting. You said something in your introduction about how to take care of one's overall health. I think perhaps one of the biggest travesties in the outside public is that mental health and wellness is somehow different from overall wellness when all the research and the literature shows us it's actually completely intertwined.
100%. And I think an interesting dynamic that's happened, certainly in this country, but even worldwide in a post-pandemic universe, is that we're starting to really see beyond literature, beyond a paper you would read in college, the real important ways that mental health, mental wellness, and how to take care of oneself impacts every component of our lives, including physical health, including our ability to enjoy all of the things that are important to us. And so I love the fact that we're in this space where we can really put good attention to something that's so important about how to take care of oneself mentally and physically, and how those really are intertwined.
So that's a great point. So as you know, I'm an emergency medicine physician and of course worked through the COVID pandemic. And I remember vividly the moment I knew that there was a second pandemic that no one was talking about, and the mental health epidemic, if you will. So can you sort of tell us that trajectory in public health? And then, of course, I want to get back to what we're doing in Jersey City.
Yes, absolutely. And I think that trajectory a little bit has always been there. But again, it comes back to we all experienced a collective trauma together in living through a pandemic. And it's one that we can argue maybe we were ready for, maybe we weren't. We throw that out the window. But when you combine social isolation, inability to meet basic needs, and a sense of unknowing into our lives, there is such an enormous impact. So this idea of let's get back to normal has a whole new meaning in our universe, because we've now seen what normal doesn't look like in such a real way that finding normality is very, very, very difficult. We've lived through this collective trauma together. So we all, in our own ways, have had this mental health crisis, the mental health epidemic, where it's come to the forefront, where our loneliness, our anxieties, depression, worry, all which does live within us, maybe the small components for some people, larger components for other, no judgment in either direction, but all of those emerge to the surface, again, as a collective whole. And we have to work on that together because it is so important. It is clinically proven that high levels of anxiety over long periods of time affects our blood pressure, affects our hearts, affects the way our minds are able to process information. And having this second pandemic, if you will, of mental health crisis is exacerbated by everything we all share together. As a therapist, for lack of a better word, it's exciting for me because we're really getting now collective traction amongst people in general of how do we manage these things? How do we take care of ourselves and really provide true self-care to make sure we can be the best who we can be and live up to those components and be able to reduce the secondary issues such as heart disease and high blood pressure, but understanding they're all intertwined together.
Could not agree more. But let me pick up on self-care. Can you tell us more about people at home are probably saying, well, self-care, that's a term we hear a lot. What does that really mean? And specifically, I have to work 2 jobs and take care of kids and, put food on the table. What does self-care mean?
Yeah, it is such a great and important question. And it's one I appreciate a lot. And here's what I will tell you. I will start with my definition of self-care, and then I'm going to end with the audience definition of self-care, because they are 2 different things. But my definition of self-care is very personal. And it is this way of, despite all of the things in our lives, taking 2 jobs, taking care of our families, being able to support all of the things we need, how do we make sure we find even the smallest amount of ways of supporting one's self? It is easy as a human being. I say that loosely. Nothing's easy, but it's easier as a human being to worry about your child's health, to worry about your spouse's health, to worry about making it to work on time. It is not so easy to look inward and say, ooh, I'm struggling with this, or ooh, I'm not sleeping as well as I used to. And what could I possibly do about that? And self-care, I think, gets scary of, well, that means I have to see a psychiatrist or I have to go see a therapist. Maybe. But it also means while you're sitting at your desk or while you're commuting to work, are there things you could be doing that also tend to your own interpersonal needs and your own interpsychic needs? And there are ways to do that. And as promised, I said it's very personal to me, my definition. It has to be personal to everyone. And that's why I say my definition might not fit everybody who I'm talking to right now on this screen. Your definition might be a little bit different, and guess what? That's okay. It means something to you, which makes it important, and that's what we need to focus on.
I agree. We'll be right back. Let's talk more about self-care.
No one plans on heart disease, but everyone should have a plan for it. We help patients of all lifestyles and medical histories plan for healthy hearts. We offer convenient screenings without judgment, hundreds of preventive programs, and women's heart specialists. And we're the largest cardiac surgery program in New Jersey. Make plans for a healthy heart with RWJ Barnabas Health. Let's be healthy together.
Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, Jersey City. Hudson County's only monument maker, serving all faiths and cemeteries. Design, studio, and launch inventory on site. Cemetery inscriptions and custom orders welcome. Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, just south of Secaucus Road. Craftsmanship that will last for all eternity. Burns Brothers, Jersey City, Albert H. Hopper, North Arlington. Visit us on the net. Consumer Carpets, 3408 Kennedy Boulevard in the Jersey City Heights, your one-stop store for residential and commercial floor treatments, carpeting, linoleum, tiles, laminates, hardwood floors, area rugs, remnants, all major brands, all in stock. Free estimates, same-day installation. Consumer Carpets, it's savings, selection, installation. Credit cards and debit cards accepted. Financing available. Consumer Carpets, price to fit your budget, installation to fit your schedule. On the net at consumercarpets.com. Consumer Carpets, Jersey City, 201-792-2712.
Welcome back to Hudson Health. I'm Dr. E.J. Akanyili. I'm Chief Medical Officer, Jersey City Medical Center, a facility of RWJ Barnabas Health. I'm thrilled to welcome back Robert Winston, Vice President of Behavioral Health and Operations at Jersey City. And we stopped at the last segment talking about self-care. So I'm going to ask you, everybody has their definitions. I really liked that. Mine is very, very loud music as I'm driving into work, which I have to turn off once I get to the parking lot. But can you give us, in all seriousness, specific examples for people who feel like they may not have thought about what self-help means?
Yeah, I absolutely can. And again, it is different for everybody. So I'm giving some examples, but starting with what we tend to focus on in our everyday lives. So maybe you're noticing you're feeling a little more anxious, maybe a little bit difficulty falling asleep because your mind's racing, worrying about what happened today and worrying about what's going to happen tomorrow. Maybe it's, not being able to feel prepared or not being able to feel like you can handle what's in front of you. All of those things are important, and all of those things are things that are tangible, and you can make a list of why you don't need to worry about that. What self-care does is it kind of wraps all of that together and gives you the ability to manage and de-stress and focus back in on the most important things. I think one of my most favorite ways of self-care is something called box breathing. And I'm certainly going to talk about it here for a second, and feel free to go out there onto the interwebs and you'll see multiple people teach you how to do box breathing. But there's clinical research and evidence about how doing several moments of box breathing can actually reset our neurotransmitters and help bring us back from an anxious point. And box breathing is very simple. It's a deep breath in for 4 seconds. We hold the breath in our body for 4 seconds. We breathe out for 4 seconds, and we hold back in for 4 seconds. In 4, hold 4, out 4, and then hold 4. And that completes your box. Again, by doing that, it's a simple way of self-care that you could take 2 minutes of your day, whether it be on your commute, whether it be prepping for that Zoom call at work you don't want to take, whether it be right before you walk in the door to meet the chaos of your family welcoming you home. Doing that really can help reset. There are other really neat examples that aren't even necessarily as complicated as box breathing, as uncomplicated that is. One of which I love, and I think this is such a great example, and it brought to me by a patient of mine, and I've actually seen this also out there on social media. Self-care for another person I know was literally recognizing that she had dry skin. It bothered her and never did anything about it. So now she takes an intentional moment every morning to take lotion and rub it on her skin. And it's not just the idea of I took lotion and I nourished my skin. It's having the thought of, I'm going to do this to take care of myself today. And while you do that, you almost repeat it to yourself. I'm taking care of myself. I deserve to feel whole. I deserve to feel well. And I deserve to feel rich with moisture, not just in my hands, not just on my skin, but in my entire spirit and an entire soul. And that's where self-wellness and these ideas all wrapped together is we are more than the sum of our parts. We're not just the organs that make us up. We're our emotions, we're our spirit, we're our soul, and we do need to appreciate everything that we are, even if it's in small pieces, like taking moisturizer for your hands.
I love the idea that you don't have to be able to afford an exorbitant vacation or something that's expensive or take time off work, that these are really little things you can do in your commute. And like you said, the evidence is there. It slows down your nervous system. And, even when I went to medical school, we weren't taught as much. But as we know more, we know how important this is for all kinds of disease processes. But let me ask you, there will still be a subset of people that need therapy or medical management. Can you just tell me a little bit about what services we have, and how we approach that at Jersey City Medical Center?
Yeah, and it's a great point. And I will say I am 100% biased because I'm a therapist. And I will tell you, I think every human on the planet can benefit from therapy. Does everyone need or require therapy? Maybe not. Does everyone need or require medication? Definitely not. But could people benefit from talking to a therapist? 100%. Think about self-care. Think about a dedicated period of time where you get to talk about you with an unbiased source, with someone who's not going to judge you, who's going to hear everything you say and provide you a level of support that you won't get from your closest family members, from the people at work, because they will be biased. They do care about you in a different way. And it's not that our therapists don't care, they do, but they care about you truly with lack of judgment. So there will be people who do need to help overcome, who can't stop that rapid thought at night and can't get to sleep. There are going to be times where you're putting on the happy face, but yet on the inside, you can't fight the depression any more than you're fighting, and you do need to reach out for help. Now, Jersey City Medical Center, as part of RWJ-Barnabas Health, offers a host of providers, of therapists, of activities that truly focus on mental health. As one of the largest mental health providers in Hudson County, and frankly, as part of the RWJ-Barnabas network in the entire state, from inpatient, outpatient treatment, we really have robust care. And I will say, and again, I'm a smidge biased, we have some really amazing, caring, compassionate therapists and physicians who only want to support people on their journey and lift them to their higher selves. It's an amazing resource that I hope everyone who needs it gets to take advantage of.
And on that note, knowing how important this is, and I know firsthand that we have great resources, there is still a lot of misconceptions out there, right? People still do think of mental health as entirely separate from something that, if I was doing well, if I'm coping, I shouldn't need it. What's the greatest misconception that you would like to dispel for our viewers as we end this show?
Well, I think you just said it. This idea that it makes you weak. It means something about your character if you ask for help. We've taught ourselves as a society that those things are true. But guess what? I find the strongest people I've ever met in therapy are the folks who were so afraid of being weak, but yet taking that risk and taking that step forward in your journey and saying, I'm so important and I'm worth the value that maybe other people see in me that I can't see in myself. And so I'm going to take a risk and I'm going to be vulnerable in front of a stranger and let them try to support me on my journey. I can't think of a stronger thing to do in life. I think in some sense, we get paralyzed by not asking for help, and it takes strength to ask for help. And so I want our viewers here to know, if you're asking for help, take it from me, a supposed expert. It is one of the strongest things you will ever do in your life.
On that note, asking for help is one of the strongest things you can ever do. Thank you so much, Robert Winston, for being here.
Comprehensive healthcare is here, here, and here. RWJ-Barnabas Health is healing, enhancing, and investing in Hudson County with its 2 newest locations, Hoboken and Exchange Place. Within walking distance or accessible by mass transit, our locations combine convenience with primary and specialty care, including cardiology, women's health, orthopedics, cancer care, and more. Let's be healthy together.
Consumer Carpets, 3408 Kennedy Boulevard in the Jersey City Heights, your one-stop store for residential and commercial floor treatments, carpeting, linoleum, tiles, laminates, hardwood floors, area rugs, remnants, all major brands, all in stock. Free estimates, same-day installation. Consumer Carpets, it's savings, selection, installation. Credit cards and debit cards accepted. Financing available. Consumer Carpets. Price to fit your budget. Installation to fit your schedule. On the net at consumercarpets.com. Consumer Carpets, Jersey City, 201-792-2712. Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, Jersey City. Hudson County's only monument maker, serving all faiths and cemeteries. Design, studio, and large inventory on site. Cemetery inscriptions and custom orders welcome. Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, just south of Secaucus Road. Craftsmanship that will last for all eternity. Burns Brothers, Jersey City, Albert H. Hopper, North Arlington. Visit us on the net.
Welcome back to Hudson Health. My name is Dr. E.J. Akanyoli. I'm Chief Medical Officer at Jersey City Medical Center, a facility of RWJ Barnabas Health. I just had the most wonderful conversation with Robert Winston, who is the Vice President of Behavioral Health and Operations at Jersey City Medical Center and a licensed therapist. Just so much to unpack from that conversation. The first thing is self-care, right? You may watch the internet and see influencers taking exotic trips and you think that's the definition of self-care, but to think that self-care are the little things you do every day to bring back attention to oneself in a very chaotic world. Everything from box breathing to just taking time. He gave an example of somebody just taking time to apply lotion, or prayer, or music. However, we can disconnect, albeit for 1 minute or 2 minutes, from a world that continues to demand more and more of our time, is self-care. And then we went to talk about facilities and approaches at Jersey City Medical Center. There is a subset of people, while Mr. Winston says therapy could benefit most people, for people who continue to struggle on their own, this is actually a viable alternative. Jersey City, we have multiple programs, therapy options, psychiatrists, a whole crew of people dedicated to your mental health. I do want to stop at this point because we started the segment by talking about how mental health should not be seen as completely separate from physical health. In many ways, a lot of the stigma we have around mental health really stems from this, right? Mental health influences your physical health in terms of high blood pressure, diabetes, your ability to enjoy the world and to thrive, quite frankly. Jersey City Medical Center is committed to the mental health of the Hudson County community. We know that post-COVID pandemic, there's been, as we talked about, really a second epidemic of mental health issues where people may not know where to turn to. They may see an acute care hospital and think that we just handle physical health problems. But we know all too well that when people do not feel happy, confident, and thriving in their lives and their communities, they also will not enjoy good physical health. It was really wonderful, exciting to delve into the subject, something I am passionate about, and I think we do such a good job as the largest provider of behavioral health services in Hudson County. Robert Winston was just such an incredible guest with a breadth of knowledge on this issue and really still sees his own patients. One last thing that we were left with is that one of the strongest things you can do is to ask for help. If there's anything we leave the section with, is that we should all be able to ask for help, and that is a sign of strength, not weakness. Thank you again for joining Hudson Health.